Without the power of God behind everything I do, I really am completely inadequate.
I'm helping the culture. These guys are part of us as well. You know, these guys are our cousin. I'm helping the culture. I'm pushing the culture forward in another way.
Hey, black child, be what you can be, learn what you must learn, do what you can do, and tomorrow.
What do you do after you read? What do you do after you know all, right? And you can say that you're truly conscious. How are you putting what you know into action?
Hey, welcome to the New Black History Maker Show. I am your host, Jasmine Gates, and we are here with episode 14. If you guys have been on Instagram, or I don't know, maybe you have to follow a certain type of people, I don't know, but I've been seeing Black Maternal Health all week, and I see a lot about Black moms and about Black maternal health things, but it's just been a lot more this week because it is an actual week. I forgot the group that actually started. Are you familiar with the group?
Yeah,
They
it's
started,
Black
Black
Mamas
Mamas.
Matter Alliance.
Okay, yeah. So they started it. So they have an Instagram page. You can go on there and kind of see why they started it. It, of course, makes sense. And it's like, why wasn't this a thing before? I'm not even sure of the year. I want to say 2017, but it may have been
5 years ago.
Okay.
So.
Yeah. I think they started it in 2017. But if you're on YouTube or if you're on Facebook, you can see that I'm not here by myself. I'm joined by Jasmine Rose. We actually went to school together. Yeah. So, it's cool that we were able to kind of do this.
Yeah.
You grow up and get into your career fields and then you start crossing paths. So she is a Labor and Delivery R.N, right?
Yes.
And I just wanted to have her come on. I saw her posting. Well, I've seen you post about it, just throughout, time. So when I thought like, okay, this is a conversation that we need to have, I was like, oh yeah, let me just see if she'll, and then you're welcome to it. So I was like, cool. So yeah, that's what we're talking about today. So please share this. This is not just a conversation for people that, for women that are expecting to be mothers or that are thinking that one day they will be mothers. I think this is a conversation that needs to happen with anybody that is connected to anybody, right? Like we all can procreate, right? People have children or someone that is pregnant, right? And I think the more that we're educated, the more we'll help like save lives literally, because we are not, given like a lot of information and we're not given a lot of access. So a lot of times it's just us saving ourselves basically. So
definitely.
Yeah. So I'm glad that you're here.
Thank you for having me.
So tell us a little bit about yourself. Tell us a little bit about yourself and what you do.
As Jasmine said as well, I'm a labor and delivery nurse, going on 2 years now. I started nursing school and I was like, oh, I think I want to do pediatrics. I love kids. I work well with kids. And then I did my OB rotation. And it was just something about connecting with the moms. And like you said, you don't you hear your family telling you how pregnancy is going to be, how the labor is going to be. But it's like when you get to that moment, it's how are you feeling? Like, how are you experiencing this time? And so being able to connect with the moms and really work with them was like, oh shoot, like I think this might be what I want to do. So then I just started to do a lot more research, and that's when I learned more about how Black mamas have like a higher rate of dying from maternal preventable risk. And so I was just like, this might be my calling, because I've always wanted to be an advocate for the Black community. And I was like, I think I can really dive in on this, working with mothers, really helping them, educating them. And so it just kind of took off from there, and women's health is like my passion now, like just educating moms about just, during pregnancy, at labor, after postpartum, even, during conception time, just, complete aspect of women's health has just been like more of a passion for me. So yeah, that was my little journey.
I love that. So I know I was looking through your Instagram, but it'll be 2 years in June since you've been. Okay. Yeah. So you love it, or was it what you expected?
I will say like I love it, but I started literally in the pandemic. So it has been a stressor in regards to starting nursing in a pandemic. But overall, I love every day, meeting a mom, especially my first time moms. Like, some nurses may not like all the questions and, the concerns, but it's like, it's your first baby. And I know when I'm there, I'm going to want to ask all the questions, and I'm going to want to have a receptive nurse that's going to be able to answer these questions for me. So I love answering the questions, helping moms to feel more comfortable, including their significant other, whoever's there to support them. It's also, what I love is it's never just a dull day. Like, it's always something new. Like with labor and delivery, we, of course, like the main thing is delivering babies, but we also have high risk moms that may come in from like having, high blood pressure. We may have moms that come in preterm labor, and sometimes I consider like L&D, labor and delivery, is kind of like the mommy ER, because anything can walk in. So like we'll have a mom where it's their fifth baby, and like they walk in, baby's like about to come out right now. You have to get, the IV and get the medication running. You have to ask all these questions. You have to do all these things. And then it's like you have to bypass all that and just here comes the baby. So that's also like a pretty fun and exciting thing. But overall, I would say I do love, what I do working with my moms. It's always a new day. It's just interesting working starting in a pandemic.
Yeah, I can imagine. Yeah, I mean, it's like nothing was the same.
Exactly, and it never probably will be.
Right. Yeah, I love that. So usually I ask the "How are you doing?" questions before. I don't know why I didn't ask that, but how are you?
I'm good. Oh, like just over. I'm good. I'm in school, so that's just another factor of my life. But I'm doing good with just balancing it, taking it day by day.
Right. And then in school for like to continue.
To be a nurse practitioner. Okay. So primarily focusing, of course, in women's health, but as an NP.
Okay. Yeah. Cool. Shout out to you.
Thank you.
And then if you watch the show, you know that I'm big on like asking and other questions outside of like how are you doing, because we have like our just made up answers. Usually it's like, yeah, okay, cool, whatever. But like I always say, I was reading an article and they were saying, it's good to ask more thought-provoking questions. So the question for this week is, what was your biggest lesson from the week?
So I would say for me, I'm always like I'm tough on myself, shall I say. And I feel like I try to do so many things, and one thing that I'm really learning, and I feel this week I really just said, Jasmine, you're a human. You can't do everything. You're going to have your bad days. Breathe. And like one thing that I definitely started to do during the pandemic was meditation. So like every day in the morning, I'll do a meditation, and that's like been a big thing. And so I definitely had to incorporate a couple more this week. And I was just like, you're okay. Like take deep breaths and don't beat yourself up. And so I feel like that was one lesson. Like I see that I'm learning to just give myself grace.
So as far as like, the meditation and like the mental health, at least for you, like, is it a lot when you're coming home, or like kind of dealing with all the moms and stuff and everything that's going on at work? Like, how is that transition home, or when you're getting back to like Jasmine out not working anymore?
I will say, so I'm not a morning person, so I have to like prepare myself when I get into work. It takes me like an hour to be like when I see my patients, I'm always happy, but then I'll go like to the nurse's station. I just sit there quiet. And I feel like the nurses now know like that's me. Give her an hour and then she'll be more social. But with my patients, I'm like right away, like, hi, I'm Jasmine. And then like switch off to the nursing station silent. But overall, I would say when like if it's a rough day where we had a lot of patients that came in fast, back-to-back deliveries, because with labor and delivery at my hospital, we have multiple roles. So one day I could just be baby nurse. So that means I'm just taking care of the baby for the 2 hours after they're delivered. And it could be a smooth sailing day, but then if we have like 3 C-sections and then 2 moms just delivered and you have 5 babies in 12 hours, that doesn't sound like a lot. But when it's like fast paced and this mom just delivered and you're working on this baby, and then you have your charge nurse calling you saying this mom's about to deliver, so you're like trying to finish your couple of assessments that you can, then you have to report to the primary nurse that's taking care of mom and then run over to there. Or another role we have is we go in the OR when moms have C-sections. So that will be our role for the whole day. So if we have 3 C-sections, that's a whole day process as well. You're not getting, you may not be able to eat as much, it's just you're really busy because we prepare mom, we go in with the mom, and then we recover mom for 2 hours. And then it's just like right when you switch that mom over to OB, you have your next patient to prepare them for the OR, and it's just you're like, did I even sit down today? So when I'm driving home, I just play my music and I just pray. And when I get home, sometimes my mom, she can tell when I had a rough day because I just look drained and she's like, rough day, and I'm just like, yeah. But overall, what I'll do is on my off days now, I'll try to do like a hike, or I'll, I make it a thing to go hang out with my friends, go to any type of events that I'm able to go to when I'm off. But yeah, I try to still do self-care time when I've had like a rough day, or I'll just sleep in.
Because sometimes that's self-care.
Exactly.
And that's self-care. So yeah, let's get into the conversation. So with you mentioning all of that, I think there's a lot that can definitely slip through the cracks, right? There's a lot that can go on. And I think it's important that moms know, people that are supporting moms or family members know that there is room for like advocacy, that even though like you guys have your set schedule, but you're allowed to say like, okay, hold on. Like, let me see something, so we're just going to get into that. So I feel like I've just seen it. And I know everybody else has seen it, but the Black women are 3 times more likely to die, than white women. Right.
Yeah.
And that's just the blanket statistic. And I know that in places like New York, it's 14 times higher. So it's being mindful of, not even being mindful, but just being like aware of what's happening. And then you have to think of like a place like New York, right? And you're thinking about the NYPD and the things that are going on there and how those things can contribute to it, So there's a lot more to consider when you're having a child outside of just your body, the child. Like there's a lot of stressors, right? And where you are. I know one lady, when I was watching and doing research for this episode, she was saying that she was like, I don't want to have my child in America. So she had went to Europe.
Yeah.
And she was like, it was a completely different experience, and not everybody is able to do that.
Yeah.
But it just goes to show like another thing that's just something to be mindful of is that it's not a social issue or a class issue. It's literally a race issue. Yeah. Like it's not, this is not a poor Black story, like a poor Black statistic where people that, are living or have insecurities with their living or with food. This is not just that. This is literally like Serena
I was
Williams.
like, we have celebrities that have discussed where, they're advocating for themselves and still being disregarded.
Right.
So their billions of dollars was blown out the door when it came to their health, unfortunately.
Right. Yeah. So we talked about it a little bit offline, but let's explain like when the moms basically see you. So I know you explained it a little bit, like when they would come in, but like at the role that you essentially play. I know you touched on it a little bit, but
yeah, no worries. So I do not really meet the mothers until they walk in. So we may have like a mom that comes in and they're more of a triage. So they may come in saying like, I see bleeding, or I think my water broke, or I'm having contractions. Or we've had moms that come in and just say, I haven't felt the baby move a lot. And so they're concerned. So that's the first time I meet them. And so I'll put them on the monitor. And then I'll just do like a full interview process to see, what their concern is, what their complaint is, as well as like how they're doing, how their pregnancy has been, because this is my first time seeing them. So I don't have any like prenatal records until the secretary gets it for me. So during that time that I'm speaking with them, I'm just seeing like if they have a history of high blood pressure, if this is their first baby, their second baby, which number, if this is multiple babies, and like how were those deliveries, if they have any complications. And then after that, then I'll see how the baby's doing. And from all the interview process, then I'll get like the paperwork and call the doctor. So that's like one way that I meet the parents or the mom and whoever comes with the mom. But then I also have where some doctors will schedule a mom for an induction. So that just means where you don't have any contractions, like you're not open, like your labor hasn't even started.
Okay.
So we're starting your labor.
Okay.
So that's the difference between like induction and augmentation. Induction, you walk in and like we're making your body go into labor. Whereas augmentation, you came in, you may have been contracting, your water may have broke, some type of aspect of you're in labor, and we're just kind of beginning the process even more by giving you medication. Okay. So that's like the first time that the moms meet me. Some hospitals do where they'll do like a tour, so you can tour the unit and see where you're going to deliver at. They don't too much have like the patient speak with the nurses, but like if you walk by and say hi or something, then we'll speak.
Right.
But there are some patients that I do see more often because we have something called a non-stress test. And so some moms who are high risk, they have to come twice a week, and we just pretty much monitor the baby for like 20 minutes.
Okay.
So those are the patients that we become like, we develop a relationship before they even go into labor. So those are the only ones that, they'll come in and like, hey, I remember you, like you put the baby on, a week ago or something like that. But other than that, yeah, that's like the first time I see the patients, and I just work hard to develop a bond with them so they can feel comfortable.
Right. And then let's talk about the importance of like picking the right hospital. So I'm not even necessarily sure about what that process is like, or how you even get to the hospital. So
Right.
If you could kind of like elaborate on that, like, okay, boom, I'm pregnant, right? So then
what now?
So what is that process like? And then the importance of like, and are there options, like with the hospitals, or is it just based on like your healthcare, so if you can elaborate on that a little bit.
Yeah. So in regards to like the hospital, I would say before, like if you're thinking about getting pregnant, you should start right now looking for like, what OB would I want to have? Or, if you want a Black OB and a Black female OB, then it's like, let me just look and see in my region, are there any, or what's the closest
And is that
OB?
something that you can do through your insurance?
Yeah, so your insurance, they usually have where you can go online, and then you'll type in that you want for OB, but you have to do research because like it'll say the doctor's name, but there won't be a picture.
Yeah.
So you have to because just me trying to find a standard just doctor, I wanted a female Black doctor. I went through my insurance, but I'm like, it took me at least, I don't know, a week or so because I was literally copying and pasting the names on Google, trying some doctors don't have pictures. So I'm like looking for a picture. I'll see the first name or the last name. I'm like, like, does that sound like maybe they can be Black? I don't know.
Right.
So like that's the beginning process right there. And that can take some time as well, just trying to find an OB. And, most of the time, there's a lot of women, you don't even know you're pregnant. And when you find out you're pregnant now, it's like, oh, shoot, I need to find an OB so then I can have my first appointment. We can see the ultrasound, see how far along I am, because I didn't even know I was pregnant until I started having these symptoms.
Yeah.
So I would just say, like, if, women who are preparing to be pregnant, just start looking at, like, if there's OBs around here that are Black and female, if you prefer a female, and see, like, there's some doctors where they will see you throughout the entire pregnancy in the office, but they work with a group. And so once you get to the hospital, it just depends on what doctor is on call that will deliver your baby.
Okay.
So I've had that scenario happen a couple times where, like, my hospital, we don't have too many Black patients, but the Black patients that have come, like, I had one, and she was like the sweetest Black lady ever. She was a C-section. And she had a Black OB, but it was the scenario that I said where and so that Black OB wasn't on for that day. And so she ended up just having, like, she, of course, most women prefer a female. She ended up having a white male, like whole opposite of what she didn't want.
Wow.
So I walk in, like I said, the patient is the first time them seeing me. So I walk in and immediately, like, her eyes like kind of lit up, and I'm like, "Hi, I'm Jasmine. I'll be your nurse for today." And she's like, "Oh my gosh, like that just warms my heart. Like, that relieved me so much." And then she just starts talking about it. She just kind of said, like, she kept saying like little things, and I knew what she was meaning in regards to like just feeling more comfortable around Black providers.
Yeah.
And she kind of just said, like, I just feel more comfortable. And I said, I completely understand like what you mean. And she was just like, yeah, you know, with like Black women passing away. And I was like, yeah. And she was like, when I heard that my Black OB wasn't going to be able to deliver, I was a little sad and nervous. And then I saw you and I was happy.
Wow.
So those are scenarios I would say as well. Like, ask your OB, are you going to be the one that's going to deliver my baby? Because, you know, if you don't know, if you're thinking the entire time, like, okay, this is who's going to deliver my baby. And then it's not. And you get like she did, like what you did not, like you preferred not to have, and you get that, then, you know, that could change your experience as well. So that's a big thing to tie into. And then, sorry, what was the other question?
Well, yeah. So I mean, but I think and then we talked about the doctor. So that's one thing. So like being mindful of that, and then you touched on like the hospital just being mindful of it. I mean, once you figure out you want to have a child, or when you figure out you are with child, I think that's something you just said, like, just be mindful of what it is. Have you had experiences where they've said like, I don't want this OB delivering my child?
So I have had some of those experiences, mainly for religious reasons.
Okay.
So it was like a Muslim patient, and they did not want a male. So that was like the main thing. Regarding, I've had patients where they had a specific OB, but they ended up coming to our hospital because they didn't want that OB to deliver them. And that's what I didn't touch on. There's some hospitals that have contracts with the doctor. So depending on what hospital your doctor delivers at is where you will have to go. So there may be multiple hospitals, but it just depends on if your doctor delivers there. So I've had those cases where the patient didn't really like their doctor, and they didn't, you know, wanted them to deliver them. So I guess they lived close to our hospital, and they ended up just coming to our hospital and preferred delivering here. So I've had those scenarios. I've only had like one time where the doctor, not every doctor is, you know, welcoming and warming.
Yeah.
And if it's a male, unfortunately, sometimes it's like you have to ease into, you know, doing a vaginal exam. You don't just, you know, go right in, and you need to be gentle because it's sensitive down there. And so the woman just did not feel comfortable with how the treatment she was receiving. So she kind of did discuss that. And we have a doctor that's on our unit 24 hours. So we just told her like the only other option she can have is to have the doctor that's on call for our hospital deliver, because she didn't want that doctor. So you can for sure advocate and say like, I do not feel comfortable with this doctor. I would prefer another doctor. And it just depends. Not every hospital has a doctor on the unit 24 hours. So then for that case, if that doctor works in like that group setting, then maybe see if they have another doctor that would be okay with being on call.
And then who do you like talk to about that? Like if you're a mother and you're sitting there, who would you ask for?
You would talk to the nurse. Like, you could talk to the nurse about it, and then the nurse can like speak with the charge nurse, but the patient would kind of overall have to tell the doctor like she does not want that care, because she does not like, because that's
they would
her
have to tell the OB that they don't
want,
like
that
they don't want.
she don't, like, because it's like,
I would have to be so awkward.
It does. I've had and they're just like, okay, if you don't want me, then you know, here's your options. And if they say they feel uncomfortable, then like I'll speak with my charge nurse. And then sometimes the case would just be, since we have that doctor on call 24 hours, it would just be the doctor that's here.
Right.
And
but they can tell you as the
they can tell us like, I don't feel comfortable, but then some nurses may just be like, oh, well, like, it depends on the type of nurse. They may say like, well, you have to maybe discuss that with your doctor.
Right. Because because then you guys have to go back and tell the doctor.
Yeah, but we would just discuss it with the doctor, and then depending on how the doctor is, I've had a doctor, he just chuckled like, oh, okay, well, she'll just have the doctor that's, on the unit.
Right.
And then that was that.
It's like such a careless thing.
Yeah, and that's exactly why she didn't want him. So
I see.
Yeah.
Well, we're going to get ready to go on our first break, but we're basically just talking about the experiences we kind of covered. A lot of like decisions or options that you have as it relates to the actual like person that's caring for you or the OB. So we're going to come back and talk a little bit about like how you can start to like kind of take care of your body when you know that you're getting ready to conceive or that you know that you want to have a baby. So all right, we'll be back.
Live from the Den, Devontae Green, proud founder and CEO of the Giants Den, also co-host Live from the Den.
Yes, indeed. Danny Crumble, co-founder of the Giants Den, also co-host from Live from the Den. Excited to engage in these conversations.
Yes, leadership, self-improvement, real conversations that Black men have or need to be having. Tune in Monday nights, 7:30. TGN Talk.
And it's only one way to end this powerfully. 1, 2, 3.
Salute.
Do you want to punch people in the face and not get fired for it? Tune in Monday night for Monday Night Compton Mania, only on the TGN Network. We'll see.
Only on TGN Sports.
Hooty-hoo! Are you looking for a DJ for your next private party, wedding, club, corporate event, tour, or even bar mitzvah? DJ Dash is the guy that can get it done. With 10 years plus experience in both audio and video DJing, I can cater to literally any crowd for any occasion. Call or text me now at area code 323-854-2013. Once again, that's 323-854-2013. And don't forget to keep up with me on all social medias, including SoundCloud, handle @approved, DASHAPPROVED. See you soon.
Hey, what's up? This is Jasmine Gates. I am the host of the new Black History Makers show where we cover all things Black, the good, the bad, and the ugly. I know you want to be in on this conversation. Live every Friday at 3:30 p.m. on.
Are you looking to take your business a step forward? Are you looking for more people to know what you have to offer? You are in luck. The Good News Radio has a special deal for you right now. You can get a commercial slot 4 times a day.
So you just when it's there, I'm.
If you are interested, email contact@tgnradio.net for more information.
Hey there, business owners. Don't miss our limited time offer. Advertise on the Good News Radio as low as $2 per commercial slot. That's right. Promote.
All right, we are back. We gotta get these things together. Okay, that's off. All right, cool. We're back. So back with Jasmine, and we are talking about Black maternal health. We just covered a lot. I think that is so the first part, right? Like the options that you have. I know we kind of talked about how you can switch your OB, but that was kind of like towards the latter end. Mm-hmm. When do you initially meet your OB, or is that like your first appointment? Or
yeah, so your first appointment, whenever you do the pregnancy test, I would say immediately start looking for an OB. Mm-hmm. And then after that is when you'll have your initial visit. They'll do like an ultrasound because they want to see based on when you say your last period was, mm-hmm. as well as based on the size of the baby, what your due date should be. Mm-hmm. And then that's when you'll start having the interactions with your OB. In the beginning, like the first trimester, second trimester, you're maybe doing like a month, every month or so that you'll see them. But once it gets closer to delivery time, then it may be every week. Well, that's like closer to like when you're close to term, right, that you'll be more every week. But yeah, you'll, depending on the clinic, I will say though, because some clinics have nurse practitioners, like mm-hmm. what I'm going to do. Right. And so you'll have your OB, but then you may see a nurse practitioner as well for one of your visits, or you may see your doctor, and it may just alternate. But yeah, that's pretty much the beginning. When you find out you're pregnant is when you initially go find your OB, and then you meet with them.
Okay. Yeah. So let's get into, because I do know that there are a lot of disparities, and we're aware of the fact that, you know, the healthcare system is not necessarily set up to benefit us as Black people, and definitely not as Black women. So I do also know that there are some preventative measures that we can take, or there are some things that we can do. And this is not to say like, oh, well, it's on us, and this is we're the reasons why the numbers are what they are. But it's like, also, you know, let's see how we can come into a space, lessening the chance with whatever power we have. So practical ways that women that are thinking about becoming mothers, or that are, you know, found out that they're pregnant, how can they, you know, start striving to keep their bodies healthy, or what can they start doing?
Okay. Well, it's just like in general, just staying, like, just to keep your body maintained in a healthy manner in general. I'll say just, you know, keeping a well-balanced diet, but also exercising a lot. Because you don't have to be like enduring, like high endurance exercises, but I would say just like walks, at least 5 times a week, at least working out, doing your walks if you can, as well as, like, I know not everybody goes to the doctor all the time, but sometimes people don't even know underlying conditions that they may have. So, like, you may just naturally have a high blood pressure, but you didn't know that. And so once you're pregnant, you know, you're now considered chronic hypertensive, but now your blood pressures are just going to continue to go up as you're pregnant, because that's just more volume in your body. So when it comes to that, I would just say kind of knowing your baseline before you even go and like start thinking of being pregnant. Because like if you do have a, you know, high blood pressure, then maybe seeing if you have to take medication, maybe seeing what's your diet like, what are you eating, and seeing if there's certain things that you need to cut off, like salt. You know, a high salt content definitely brings up your blood pressure. And so if you're wanting to become pregnant, it's just going to be higher and higher. So, you know, starting to change your diet and your habits in the beginning will help you during your pregnancy. So I'll definitely say that's like a big factor. If people are able to, like, every now and then I'll check my blood pressure and just see like what is my blood pressure. And I would say just one thing while you're seeing your doctor, because like when we have our prenatal labs, that's a big thing that a risk that moms have is preeclampsia. That can be like one of the indicators of why a mom is either induced or have like a emergency C-section, because they're going into like HELP syndrome, and that's when it's like downhill. You need to get baby out because mom is just getting sicker and sicker. So like hypertension is something that we can manage, and that's like a high number in the Black community. Like it's very common in the Black community to have high blood pressure. So I just think that's something that we should be looking at right now. Like, what is my blood pressure? If you can, you know, I know Walgreens or CVS, they have like those little machines where if not, if you can buy your own at home one, every now and then check. And then once you're pregnant, I would say just keep a little journal and see what your blood pressures are. And if you see them start to trend up, you know, you need to immediately address that to the doctor, because they're doing it in the office. But if you're seeing at home, your readings are higher and higher, that's concerning. And that's when you need to address it to the doctor. Like, you know, I'm concerned my blood pressures are high. It's normal, you know, to have a little swelling, but if your feet are huge, and that's like more towards when you're almost 40 weeks now, you're just carrying this, like it's just all baby now. It's common to, you know, have a little swelling, like very mild. But if you're having like huge swelling where you can put your finger in your leg and you still see that indent and your hand's not even there, that's super concerning. Or if you're having a headache constantly, that may be your blood pressure. So stuff like that, to be mindful, like you just know your body pretty much. So if you're feeling like, you know, something doesn't feel right, and then you check your blood pressure and it's high, that's when you now need to address it with the doctor, because you may need medications or you may unfortunately need to deliver baby earlier because you're just getting sick.
Right. And then once you are seeing your OB, are they giving you, is there like a, I mean, not necessarily a physical, but like a blood test that they're doing just to see everything or see what you may be high risk for?
Yeah, so they do like a general lab work, like a CBC, to see like if you're anemic, check like your white blood cells, your platelets, stuff like that. And then they also will check to see like, you know, the STDs, HIV. That's like a general prenatal lab that we as a hospital need to see when moms get here.
Right.
But then once moms are about like 24 weeks, around that ballpark, 24, 25 weeks, they'll do gestational diabetes tests. So they drink like this nasty drink and then they test their blood sugar. And so if it's over a certain range, then they have gestational diabetes, which just means like you're diabetic from pregnancy. And so depending on the rate and what the doctor wants to do, they may just do diet control. So a lot of things can be managed with diet. Or if they feel like the mom may need medication, which would be like insulin possibly. But those are some of the tests that they do. Then further along in your pregnancy, then they'll test for GBS, which is just like a group beta streptococcus, like that's the word, but it's like some, you know, bacteria that women have that's not harmful to us but can be harmful to babies. So for us to know that, so that if they are positive, then we treat mom with the antibiotic once they're in labor, but that's only for when they're in labor. But those are some lab works that they do, and every time you go to the clinic, they check your blood pressure and your pulse, and then I don't know fully, but I know they should do like a general, like, you know, how's things going, interview, assessment. And then they'll check the baby and then go from there. But those are like the standard labs that they do, and like they'll check your thyroid and everything. But those are like standard labs that all moms should be getting in the beginning, so that we know like what's the baseline. And then they'll just do a general interview assessment of like, you know, before pregnancy, how was your health? You have a family history of high blood pressure, diabetes, you know, stuff like that. Just so they can kind of have an idea.
Yeah, and I love how you said like just keeping track or keeping like a journal or something. I know even for me, and like a few weeks ago, we did an episode on it was not Black Women, it was Women's History Month, but we had all of the episodes that month for Black women. So one of them was a health episode where we talked about, I just got over like having rheumatoid arthritis for like 3 years. And then the other person that was here had like a brain tumor. So we were talking about just the different things, but then me having to be mindful of like my rheumatoid factor, my inflammation factors and all of that. So me checking them and knowing, I always shout out Kaiser because the healthcare provider I had before wasn't as good, but my test results come to my phone. And then they also have something where you can look at, you know, the number, or you can look at the graph and stuff. So I'm able to see
the
like,
range and everything.
So I think that's like something, you know, to know. And I can call my doctor and get them to send a test whenever, and I can just go to any, you know, Kaiser and get the test. So
I love Kaiser.
So I think that's like a good practice to have, whether you're pregnant or not. But
just in general,
just knowing like what your tests are and stuff. Because I know I had a friend, or I don't even think it's a friend, but somebody I was talking to, but she was saying she was experiencing swelling, and she wasn't pregnant or anything, but she just had swelling and stuff. And I knew that I had rheumatoid arthritis, so I knew that they need to check your rheumatoid factor, and then they need to check the inflammation marker. And I was like, that should be a common practice. But they weren't doing that. They were just telling her to lose weight. So then when she went to go get the inflammation marker checked, they were like, oh, so you may have some type of other condition, but they never checked it. You know, so it's one of those things, like, definitely advocate for yourself. And then also, if you know your test scores, like, I was able to go in and tell my doctor, even though she saw them, I was like, okay, well, I don't want to be on this medication anymore because we are at my goal, basically, you know, because I'm looking at it. But usually people don't look at their numbers, and they wouldn't have known that, you know, they were at the actual goal of whatever. They're just going to keep giving you the medication. So I would say that, like, definitely, I don't know, you know, wherever, I don't know how the other healthcare providers do it, but get access to like your lab results.
Oh yeah,
You know, like definitely have those so you can look at them. And then especially if you are pregnant and you're noticing the change and the doctor is not mentioning it, you know, mention it.
Yeah.
You know, and say like, hey, this is concerning me.
Yeah. And when some moms get to the hospital and, you know, we put them on the monitor and, you know, their blood pressure is like 140 over high 80s, like that's pretty high. And so I'll say like, oh, what are your usual blood pressures? And they're like, all they say is they've never said anything in the hospital, like at the clinic. So I think it should be fine. Or they just say it looks good.
Right.
So it's like, you don't know what the range is. And so like that helps us nurses as well to kind of put the story together for the doctor when we're calling them for a report. So I would definitely say just some way, somehow having a journal or something, just knowing like what are your blood pressure, what are your, you know, if you're diabetic, what are your blood sugars readings? Like those type of things are very important and can help with the plan of care for the patient.
Right. So I want to go in a little bit about the natural practices versus like the westernized. I know we talked a little bit about it earlier, but I think there are definitely people who push for the natural way, and I know I'm like a natural head too, so I definitely like love that way. But then I also like through research, you learn that it's not the best, you know, for everybody. Just like being vegetarian, being vegan is not the best for everybody. It'll have some people laid out, you know, like you know. So I guess with your experience, I know that you're in the medical like field, but just the importance of it when, you know, it would be okay, you know, to go the natural route and when it wouldn't, you know, if you can just touch on that.
Yeah. So I know a little bit about the natural just based on like, you know, stories and what I've seen. But in regards to if you want like either a at-home birth or a birthing center, which is more of like the natural way and not the Eurocentric way, I would say you can't be high risk at all. Because if you're high risk, then there's a lot of interventions that need to be literally like right there when needed, as well as frequent monitoring of the baby. So
can you give examples of like a high risk
pregnancy? Oh yeah. So like hypertension, what I was just talking about. If you're pretty much have hypertension, then that's more of a higher risk because we're needing to monitor both you and the baby, seeing how baby's tolerating and how your blood pressures are doing. If you're gestational diabetes, your baby may be larger, and just monitoring the baby. It's more of like needing to monitor the baby more frequently. And so when it's more natural, they don't monitor the baby as often. I don't know like what the time frames are, but I think it's like maybe every 30 minutes for a certain, like maybe for 10 minutes in that 30-minute period, or I don't know. I could be wrong, but I just know it's like we have the moms on the monitor the entire time to see how the baby's doing. And so that could be a high risk pregnancy, as well as if a mom had a C-section, but they want to now do a vaginal delivery, you're immediately high risk. There's a way where you can, you know, for those moms that think, oh, I had a C-section, I can't have a vaginal delivery. That's wrong. You can have a vaginal delivery after. And there's some doctors that may just say, oh, well, you've had one, like, let's go, you know, you have to do a C-section. Now, if this is your third C-section, then no, like that, you can't, that's just way too high risk. But if this was you had one C-section and then you waited at least like 3-4 years, like your scar is healed, then yes, you can try. If you're close, maybe a year and you're about to have another baby, I don't know, that's still high risk as well, because you know, you have that incision at your uterus. And so the risk of it rupturing is very high. And so that's why we have to monitor the baby the entire time. So those are, and then of course, like if you have cancer, or if you have any type of, you know, illness, sickle cell disease, even like maybe possibly if you have like rheumatoid arthritis, any type of thing where it's like you need to be monitored more, that's high risk right there. But if you're just overall healthy, no issues, you know, then you could do natural. And so with natural, there's no medicine, so you're feeling all the pain. And like I said, it's not continuous monitoring. And it's usually more with a midwife than the doctor. And, with natural, if you deliver at home, you can deliver wherever. I've seen a lot of water births. So a lot of moms have that huge tub in the middle of their living room, and that's where they deliver at. But then when you go to, and you don't have to have an IV in, those are more like the natural scenarios. Whereas if it's more hospital based, you have an IV. It's pretty much continuous monitoring, depending on the hospital, though, because I've heard some hospitals that have bathtubs in the hospital. And I was like, I want to deliver there because I definitely, right now I say I want to do natural, no pain medicine, but we'll see. But warm bath really does help. Warm water helps a lot to relax your body, relax your muscles, and help your body to just dilate more.
Are those like more high-end hospitals that you're saying that they have?
I can't remember what hospital it was, but when I heard, I was like, ooh, a tub in the labor area,
right?
That's nice, but I know that's more money,
right?
So.
And let's also go into, because when I was doing the research of like a doula versus a midwife, what I didn't realize was that a midwife is also like a more clinical position. So are there midwives where you work, or?
No. So my hospital unfortunately does not have midwives, but Kaiser have a lot of midwives.
Okay.
Like my sister and I, we were born like a midwife delivered both of us. So Kaiser for sure. There's a lot of midwives there.
So okay, I guess let's get into that. The midwife, and what role or where do they play? Yeah, where do they to play?
So midwives they're, in a sense, I'm not going to say they're like a doctor. So they can deliver babies. And so, you like at Kaiser, if you come in, you may have the midwife who delivers you. You may have been seeing a doctor, and the midwife can be the one to deliver you. They can, if you tear, they can suture you back up. I believe they can do C-sections as well, but I'm not 100% sure. So yeah, I would have to check on that one. But I for sure know they do like vaginal deliveries. They can suture moms, administer medications, pretty much those type of settings. And you can see the midwife like during your pregnancy and then at the delivery as well.
And then the midwives, as far as like the schooling, are you like knowledgeable about that, or what they have to go
a little
through?
bit? So I do know. So there's different types of midwives. You can have just someone like that just want like straight into midwifery, or you can have nurse midwifery. So like me being a registered nurse, I can go on for my master's and become a nurse midwife. So there's different types of midwives, and there's different types of schooling. I know for nurse midwifery, I believe it's like two years or so. It might be the same for just an entry level midwifery, pretty much.
Okay.
Yeah.
Okay, that's cool. So then, so the doula and midwife thing. So I have notes basically. So for the doula, it's more of like the holistic approach. And then like you said, it's all the natural thing.
Yeah.
And then doulas can be present in the hospital.
Depending on the hospital. So with COVID,
because now it's different. But before,
prior to COVID, yes, you could have. A lot of people had doulas, so you would have your doula, your whoever, your mom, your dad, your significant other, whoever you wanted. You could have. Well, it was still a certain amount of people, but you would have more people in the room to support you. Now it's one person, but you have like your doula in your ear, because I've heard moms who have delivered and they said that they had either their doula, like they were speaking to them via phone call, or they were zooming them to where they were still supportive, because the doula is not just in labor. You see the doula during your pregnancy a little bit, and then you see they are there for your entire delivery, and then postpartum they're there for a little bit as well to help you. So they doulas don't really administer medication, but they do more of the supportive, like you said, holistic avenue of helping moms through their pregnancy, helping them, which they need the most help during your labor, especially if you want to do, if you have a specific birthing plan. and you're in so much pain, you're tired, you have somebody that can advocate for you. So that doula can be the one. They are aware of all the medical terms, all of the medical medication. They're aware of all of that. So they can be the ones really advocating for you, telling the nurse or the doctor or whomever, that's not what we said we wanted. Do we need to go into a C-section right now? Do we need this medication? Like, they can be the ones to kind of advocate for the mom during that time. And then postpartum, helping the mom's transition to now having a baby.
And I think that's important too, because if you are high risk and you're like, oh, well, maybe I can't have a natural birth or whatever, you can still have like natural aspects.
Yeah.
Or,
of
it. So it's not like all.
It's not. Lots. It's just more of you can't. It's safer to not deliver at home because you need to be monitored if you need interventions right away. And another thing, I said a lot about moms, but also if your baby's measuring small, that can be a high risk right there. Or if your baby has like some type of genetic condition that you have, that's another test that they do when you're pregnant. They test for like certain genetic conditions. If there's that, then that can be a high risk as well, because now it's like baby's concerned, mom's okay, but we're concerned about baby now.
And that was going to be another question too about at what point could the baby be the factor of the high risk? So 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 we talked about the doulas and the midwives. Another thing that I researched was like the history of midwives. So like back in the early 20th century, their Black midwives were like really a prominent thing, like really just a popular thing. And it wasn't that they just took care of pregnant, mothers, but they also took care of like the community and stuff.
Yeah.
So I think the number was like in Tennessee at one point in time, there was like 1,000 midwives, and that was like maybe between I'll say like not the early 20th century, but like mid 20th century. That's when that was. Then it started switching to where the primary like care was going to doctors, basically. So when that happened, it basically like started pushing people away from having midwives or dealing with them and stuff. So then they become like not extinct, but they just weren't as needed, or people just didn't see the importance of them. And not even only that, but doctors were also pushing for midwives not to be a thing. It was like, oh, it's not sanitary or it's unclean or whatever. But I know that it was something that did last a little longer, like in the South, they kind of stayed around. But the numbers were really alarming because like I said, at one point in time, there were 1,000 midwives in a place like Tennessee, but now they're saying there's like today, there's maybe, I think 900 in the whole country. And it's like really concerning because the mortality rate has risen, and it's kind of just like, okay, so they know that, midwives are important and stuff. And then of course, I know there's studies that show that Black babies survive or have a higher chance of surviving when they have a Black doctor, which is really crazy because we talked about it earlier, how that number doesn't change when there's a Black doctor taking care of a white baby. So it's really concerning, but it just made me want to dig more deeper into like that space with midwives and stuff. And I know there was some legislation that was supposed to be pushed about, or some initiative so that midwives could be kind of like there could be community midwives so that there was access to everyone. But they were saying that the pay was less than minimum wage. So they denied it. Because it wasn't beneficial for the midwives. So I think it's something that we as a community need to look more into and kind of like get behind and push, because it's crazy when you think about it. And it's the same thing. I talk about it with education. Black kids that have Black teachers under, before third grade, there's a 15% higher chance of them getting into college. And then if they have two, it raises to 30%. So it's like, if we know that there is a higher success chance for our children and a higher chance of survival, why would we not, advocate for that? So, I'm like really like, I think we need to really make a push for like midwives and just making that a thing. Black midwives and then being in your, field too. Cause I know for me, personally, that was something that I've been for the past 3 years. It's like, okay, when I get ready to want to conceive a child, I have rheumatoid arthritis. Like this is something that I'm going to have to be mindful of, but having the knowledge and stuff would make me more comfortable, you know? So
definitely.
Yeah, I think that's definitely something
that needs to
push.
be. Yeah. I mean, there's the momnibus that like is being discussed in
Wait, okay, let's hold on to
that.
Okay. Momnibus, remember that, but no, I was like, okay, let me not, because I didn't want to cut you off. So we'll be back with more about the momnibus.
Yeah.
Because I didn't want to cut you off. So we'll be back with more about the momnibus.
Yeah.
Are you looking for the best barbershop experience? Then the Locker Room Barbershop is the place for you. Check them out at their new location, located at 16900 Lakewood Boulevard, Unit 204 in Bellflower, California. If you would like to book an appointment, you can check them out at thelockerroom05.com or on Instagram at The Locker Room Barbershop LLC. Feel free to call the number 562-202-9602. Again, that phone number is 562-202-9602. Can't wait to see you at the Locker Room Barbershop.
Manuel Jones, also known as Zach, the original Black Ranger. Hey, and make sure you're checking out TGN Radio. Hey.
Peace, family, brother Reezus. I'm here. You already know I'm checking in with TGN Radio, Black owned. So you already know that's where I'm at. Tap in.
Hey everyone, it's the Primos Chidos. Hopefully you're enjoying this show, but if it sucks, be sure to check out our show, live Thursdays at 12.
Yeah, join me and my sister and basically my brother as we discuss everything from immigration to ejaculation.
If that sounds interesting, then we're the show for you.
Warning, the following podcast features discussion of sensitive topics, graphic content, and uncensored stupidity. Unless otherwise stated, the featured content is not discussed by professionals or experts. TGN and the Primos Chilos must advise against taking anything said on this program too seriously. Viewer discretion is advised.
Wellsy, it's Deshaun Showtime Watkins, and you can tune in to Compton Mania Monday nights, 9 o'clock on TGN. Wellsy.
Only on TGN Sports.
Are you trying to buy a home, car, or make other investments and being discriminated against because of your credit score? At credit909.com, our professionals can help you remove judgments, student loans, child support, medical bills, and other erroneous and negative items on your credit report. Call 800-752-9763 today for a free credit analysis and consultation, or text credit to 909-688-5461.
Hey there, business owners. Don't miss our limited time offer. Advertise on the Good News Radio as low as $2 per commercial slot. That's right. Promote your business up to 4 times a day, every day for a month on live radio. If you're interested, email us at contact@tgnradio.net. Once again, that's contact@tgnradio.net.
Are you looking to buy a home? If your answer is yes, call the Walker Group at 310-421-6464. With over 18 years experience, the Walker Group has serviced clients throughout Southern California with their real estate need. Let us be of service to you as well. Once again, call the Walker Group at 310-421-6464 or visit our website.
Alrighty, we are back. This new Black History Maker show for the third segment, the last segment of the show, but we are talking about Black maternal health. We have covered a lot. I'm like definitely enjoying the conversation because I think this is like when I'm talking about or talking to people about the show and like what I want the show to do, I'm like, this is the stuff, you know, where stuff that you can't, where else are you really hearing this? Like maybe on big networks and stuff, but like on the podcast that like, you know, we're starting and stuff, I think it's not necessarily talked about. You know, it's a lot of conversations about a lot of other stuff. But I'm like, this is important, especially with our age group because we're in our 20s. So, you know, So, it's like, this is the time and stuff. And I think, you know, something like I went through a, you know, well, what is the word? Not a reality check, but like, you know, when I was diagnosed with rheumatoid arthritis, where I realized like, okay, my body is not doing what it's supposed to do, you know? So I can imagine that there's a lot of mothers who are probably young who thought they would be able to carry, you know, full term or be able to go through a healthy pregnancy and they didn't. So I think it's one thing that I've learned is like, it's okay if your body doesn't do what it's supposed to do, but then what can I do to help get my body back on track? So that's something, we're not mothers, and I'm not a mother either. But it's still important for us to have this conversation, and especially as, I mean, do you want to have kids?
Yeah, one day.
I want to have kids. Not right now, but at some point.
Exactly, one day.
I think it's important for us to, one, be educating ourselves. I think that's the most important thing. That we're two women that desire to have kids, but we'll be going into this a lot more knowledgeable than maybe most. I guess you
that
could
don't
say.
know what to expect.
Yeah.
Yeah.
So that's what we're talking about. If you've been seeing the flyer that I've been posting, we are celebrating 4 years with New Black History Makers. So thank you. We are celebrating. So if you're free, come.
Awesome.
April 30th. It's a Saturday. We are celebrating at Peace of Mind. And if you've been to any of our events, like pre-COVID, like 2018, we're kind of bringing that like vibe back. Got some poets coming and like some people that performed back then, so it's cool to see like what their work is like now and all the growth and everything. But we have like a good time planned for you guys, so please come out April 30th. Like I said, we're at Peace of Mind. It's in Compton. It's free. So yeah, just come out and like celebrate with us. But back to the topic, you were talking about Momnibus, so you want to touch on that?
So this is a bill that is being pushed, but within it there's different policies within this Momnibus. Like, it's a whole universal thing. And our Vice President Kamala Harris is someone that is very big in advocating for the Momnibus, as well as other senators, as well as representatives. And so within that, there's one regarding how you were talking about the midwives. There's one for about diversity inclusion for more healthcare providers. Okay. So in regards to that, I was just like, that's a thing that where the government, at least with this bill, will try to advocate to push for more Black healthcare providers within the medical field, because they see how low the statistic is compared to just other white counterparts. And it's not that, Blacks aren't wanting to be doctors and nurses and midwives. It's just more of the acceptance rate, because it's like you need to go down to the colleges and see what is their acceptance rate, what is their diversity acceptance rate, and follow that trend to see regarding now the doctors and everything. So that was just like a little thing that I wanted to touch on.
I love that. And I think one thing too that I wanted to touch on too is since we've been talking about the healthcare experience and stuff, but what I didn't know is that when you talk about like the maternal health, that's a much longer period than just the 9 months. So what I learned is that the mortality rate is something that they calculate, and it's up until a year, right? Up until a year after the baby is born. And then also we talked a little bit before about the preventative steps that you can take if you know that you're going or you want to conceive, right? And of course, if you did not know that you were conceiving or whatever, you just found out that you wwere pregnant, then yours of course starts when you find out that you're pregnant. Well, actually it starts before. You just didn't know. But I think you have to be mindful, if you are planning to conceive, that is when your maternal health starts. And then also the gap of, I think not most of them, but there are some plans that I was saying cover up to 60 days after you give birth. So there's a gap there where you basically are needed to be cared for up until a year. So if you're only getting, 2 months compared to 12 months, of course there's 10 months left where what are you doing?
The care.
So that's something. And if you can touch on it, is that something that you can advocate for, or is it just what your plan is?
Well, that was in the Momnibus.
Okay.
They just literally on, what day was it? I think Tuesday.
Was it Wednesday?
Yeah, Wednesday. Okay. They had like a discussion about all that is within the Momnibus. But yeah, that was one of them as well, pushing it to a year for Medicaid, to where moms are able to receive care until a year, because I believe it's like at 8 weeks or so that, you know, they see their OB after delivery, but it's like within that time frame, there are so many questions the moms they have. And then after that, you're not really being cared for. And so it's like, there's so many gaps. There's so many things that can happen within that time where, you know, for like the mental health aspect, postpartum depression is real and it's big, and that's one thing that's not discussed that often. And you know, moms from older mothers may hear like, oh, you know, you toughen up, like it's okay, you just had a baby. But then it's like, if this is continuing on, that you're feeling, you know, some type of like you're not feeling normal, you're depressed, it can go as far as to postpartum depression and psychosis, to now where you're wanting to harm the baby. And so when it comes to those type of, you know, avenues, it's like they need mothers need the support and services for that, and it needs to be discussed even more, and that could be tailored into the 1 year postpartum care that should be covered, as well as just, you know, you're bleeding for some time after, you don't just stop bleeding. And it's like, you need to be cared for that, seeing, you know, being checked on, as well as, because you just kind of go back to your general provider, but they're just, you know, just general questions. They're not OB, so they can only touch on so many things. So in regards to that, I just feel like that is for sure a bill that needs to be passed, and needs to extend to a year, because moms need better care up to a year. Let's be real. And it's sad because some countries have that, but it's like, you know, we're not a third world country, but yet our health crisis for maternity is horrible.
I think I read, I don't know the actual number, but it was something like we have the highest mortality rate out of the industrialized countries. So it's really concerning, you know, and it's, of course, you know, we say that when America has a cold, Black people get pneumonia. So we always get the short end of the stick with those things. And it's unfortunate that it's kind of just something that's chopped it. To be like, oh yeah, Black women die at a higher rate. And it's like life is lost. You know, I mean, if we lose life at almost every corner of this country, but it's like life is lost from an experience that should not be taking life, you know?
It like just became now like a known public health crisis, to where they're seeing, you know, these mortality rates have been just, that's been, you know, forever, let's be real. But now it's being identified that like this is a crisis, that Black women should not be dying, especially from preventable, you know, care of pain or hemorrhaging internally, and you know, you being disregarded and then dying. And then it's like, what was her cause? Oh, well, she bled internally and we disregarded her pain. And it's like, that could have been prevented 10 hours ago. And that's more of like Kira Johnson's story of how she died, just sitting in pain and internally bleeding. So it's like, those are things that this is a crisis that needs to be addressed. And, you know, with the Black Maternal Health Week, and, you know, now having legislators really advocating for this is helping it to become more of an eye opener for the world. Like, we're serious now. It needs to be discussed, and it needs, change needs to happen.
For sure. So I want to also a little bit of the history. Well, I think it's important because some people will like hear this and and be like, well, it's not just a Black thing, or feel like, oh, well, it's not that, right? Or you guys are taking it, you know, too far. But I think what's important is to know historically where things come from. So you look at gynecology and the man that they, you know, deem as the father of gynecology. So it something where even when you look at his notes or what was recorded, he's speaking of the agony that these women were in. And if you don't know, where he basically developed his studies on gynecology by practicing on enslaved women, and without anesthesia, without anything, he's just practicing on them. So there's one record where he's writing like, oh, well, she's basically like claiming like for her life, basically. And he's just doing this study in front of doctors. There was another one where he had to do 30 procedures on the woman. And in his notes, he says, oh, I think she's going to die.
Yeah.
And it took her
nothing.
Yeah. So and it took one of them like 3 months to kind of heal. And I can imagine it probably wasn't even healed. It probably was just
him saying it was healed enough to now
right. But
begin
I'm
work
sure
again.
the lasting effects of whatever, was going on changed her life, and it was just a horrible experience. But that's something to note, that what they're using to try and help us or to get us to give birth was something that they basically used enslaved Black women to develop studies that would benefit white women.
Yep.
And then now that we are, in a space where it's like, oh, you guys can get care too. It's like, well, you guys are not paying attention to us, or you guys didn't even, the studies that you're going were not based on our
us.
bodies.
Yep.
So that's something to note as well. And then another thing, this doesn't necessarily have to do with like maternal health, but it has to do with the medical field and how they basically look at us. I've talked about it before, but the study that was done, I think is it the University of Virginia? I had it in here. Yeah, it is the University of Virginia. So they did a study in 2015. They basically did a survey with their aspiring, with their aspiring medical students, and then also actual doctors and stuff. So they did the they were supposed to answer true or false to some situations. So basically, like, do Black people experience more pain with this, or do white people experience more pain with this? So let me get, oh Lord, I'm sorry, y'all. My phone should be on do not disturb. So this is what it was. A majority of the true beliefs, or the majority of these aspiring doctors and actual doctors, had marked true for things like whites are less susceptible to heart disease than Black people, and then Black people are less likely to contract spinal cord diseases, and then also that white people experience more pain than Black people. So these are like people that society has told us are the cream of the crop, and this is what they're saying. And then another one that they collectively, like, majority of them agreed on, is that our blood is thicker than white people, and our skin is thicker than white people, and then that we also have a stronger immune system than white people. And when I was reading the article, the lady that basically did the study, even with all of the information, so something in her decided to do this study to figure out why Black people are not being treated as they should be. And she even in the thing was like, well, I don't think it's a race thing. I just think these are just common beliefs that people have. And I'm like, so the fact that Black people can't feel pain is not like a racist thought. Like, she, even with all of this information, still was like, it's not
she
racist.
was still trying, she was still trying to cover it up.
No, just people just think that, like, it is what it is. And then it goes to that where even with J. Marion Sims, I was reading another article and somebody was like, well, he was just a man of his time. And it's like basically saying that because there was a lot of racism going on back then, like, it wasn't bad because he was just,
we didn't see Blacks as human back then.
Right. So it's like, we have to be mindful of those things and where they come from. And then for people that are like, it's not that anymore. Well, when did it switch?
It hasn't. For her to be able to, try and discuss why this is still not a race thing, and this is how they think. But you're right. The way you think is racist. So,
so I think that's something to note. Like, we look at these things, and I know some people want to believe better of the world, but you have to look at the origin and where these things come from. And the fact that we as Black women, we don't even have another option. We don't have another option except to go by the way that they taught gynecology. Like, there's no other, way we can figure out ways, or try to add things to our experience. But we were literally put here and just have to deal with what they've given us. So that's just like the history and stuff for anybody that wants to say, like, it's not, a race thing or anything, or that this, that wasn't their intentions. And it's like, well, the father of gynecology, that is what they have deemed this man.
They finally tore down his statue for acknowledging that he tortured enslaved Black women. To be the father of gynecology.
So that's just something to, like, be mindful of. Just a little bit of like the history there. I also want to touch on like the importance of like a birthing plan.
Yeah.
Now my question would be, is there room for like for the birthing plan? Is it strictly like the medicinal stuff or like the medical stuff, or can you actually put like the therapy in your birthing plan and stuff?
I would say do it all. But I'm all for birthing plans, but I would just say also be mindful of, your body is your body and things happen. In regards to what I'm saying for that is, so like if you don't want your water broken, but your water naturally breaks and say the umbilical comes before the baby, that's an emergency C-section because the umbilical cord is what provides the baby with the nutrients and the oxygen to survive. So for sure, put everything that you want on the birthing plan, but I would say just be mindful that just because we don't have control of your body, it can go different way.
So things just always don't go as planned.
Yeah. So I would just say for that part, like there's a lot of moms that come in with the birthing plan. And I asked them before we like I said, I do my full interview when I first meet the mom. So I asked them, do they have a birthing plan? Because I want to respect and honor what they want. Some say yes. And so, most of the time it's that they want it more natural. They don't want an epidural. They want to walk around. Some moms say they don't want to be monitored continuously. Regarding like my hospital, based on how the baby is, sometimes like if your baby's constantly decelling, like we have to see what's going on because there could be a cord around the baby's neck and we don't know, and you may need a C-section, and that is what I mean by your body just changes and we don't know, we don't have control of it. So definitely I say cover everything. Like if you want the lights dim at all times, if you want like for sure check with the hospital if you're able to have a like humidifier or whatever, air purifier, because like my hospital unfortunately doesn't allow, but some hospitals may. If you want LDE lights, or if you want to play music, if you don't, while you're sleeping, ask the nurse if can they keep it quiet, or can they try to put all of their plan of care combining together, because we have to check their vitals and everything, see if they can combine that all together with the vaginal exam rather than doing it in different times. But I just say put everything that you want for sure, and then address it, because not every nurse says do you have a birthing plan, so address it like I have a birthing plan. And most hospitals, they wait at least 1 minute before they clamp the cord for the baby, because we see how beneficial it can be. We don't wait after a minute, but we do. That's a lot of moms' birthing plan as well, to hold off to clamp the cord, umbilical cord, before they cut it. And so I'll usually just say like, oh, we do that for sure. Skin to skin. Not every hospital is a baby friendly hospital, so they not every hospital puts the baby right on your skin, but that's very beneficial for both mom and baby. So putting that in your birthing plan, just step by step, saying exactly what you want. But like I said, having in the back of your mind, if it goes a different way, it is hard and it's tough, but just know it's for the well-being of you and the baby. If it, was an emergency type of situation. And that is a case where moms a lot of time do need all the support. And, you may be concerned for postpartum depression, because it's like they had this exact idea of how they wanted to deliver their baby, and unfortunately they weren't able to. And, it is so unfortunate, but the body, no,
I'm sure.
But yeah, for sure, I'm here. I know I'm gonna have a birthing plan. Like I feel you should have a birthing plan that states what you want, and you tell the nurse, and you can discuss it during your visits with the doctor, that you want X, Y, and Z for your labor. So
yeah, I love that. I think all of this information has been like good. I think just being aware and knowing like what your options are and stuff, because I mean, before social media, it kind of was just like, oh, you have a baby and it's beautiful and it's a blessing or whatever. And I realized like I don't want to say it's a curse, but it's been, I guess, somewhat of a blessing to see like, okay, birthing a baby is not always the most glorious thing. I don't think it's glorious at all. Like it's not like a glamorous thing.
Don't come in there thinking it's gonna be you're done up and you sneeze a baby out. Like
but I guess before, even I guess growing up, it was just kind of not talked about. So now you could just be scrolling on Instagram and see that there was you see someone's birthing like story or whatever, or them talking about it, or you know, and unfortunately there are, you know, mothers that their babies didn't, you know, make it over and stuff. So those kind of stories too, where things just didn't happen, or the mom, you know, didn't make it, you know, through the giving birth or whatever. So a lot of those things have just been more visible. And it makes you just want to like be aware of like your options and just different stuff.
Research is like the biggest thing. If you want to be a mom, I would just say just start researching all different things. What do you want? What type of hospital you want? What type of provider you want? Which you won't take. And then make sure you have a strong support person as well, because it's like you need all the support there. So educating them as well, because when, like I said, if you want natural and you don't want an epidural, when you're getting 6, 7, close to 10 centimeters and now you're pushing, you're not thinking about your birthing plan. You're thinking about get this baby out because it hurts so much. Like it's a lot of pain. So it's now like on the support system of what I told you I wanted. So now I need you to be my advocate, because at this point I'm very vulnerable and I'm, you know, focused on pushing this baby out and my well-being of my baby, of our baby and me. I need you now to advocate for me. So there's just many different things that tie into pregnancy, labor, delivery, postpartum, and just like, you know, becoming mentally prepared for that and physically prepared for that time.
And do you see, well, yeah, I guess, do you see where there are women that come in there and then like by themselves, or they don't really have the support system?
Yeah, I see that. For my hospital, we have a lot of Chinese patients that come from China, and so I see that a lot for those patients. Or I'll also see a lot where it's like they have the support person, but they're knocked out the entire time, like not there, like
absolutely,
like zonked out or like on their phone. And there's been many times where, you know, the mom thinks that the father baby is going to be there supportive, and she gets a, you know, rude awakening, unfortunately. And so then that's when, like, I'm a very personable person, so I like to be there for my patients. So like I'm just there, you know, helping them, I'm always in there like, do you need anything, are you okay? You know, just kind of spiritually helping them and mentally helping them, because there are those times when they either don't have anybody there, or, you know, they physically have somebody there, but they don't supportively
really
have somebody there. So in those scenarios, that's where I just, you know, dive in even more, just really trying to see like, what can I do to really help this mom to still have a good experience? Because it's not, you know, glitz and glamour, but every mom should still have a good experience of their laboring process. So being mindful of who your support person is a big thing.
Right. I love so that, because even I was watching Grapevine and they did an episode, I think 2 years ago, on the same topic, and they were like, a guy was a co-host and he didn't talk too much, but he was just like, you know, it makes him think that, well, I guess his thing to women was like, you know, beware of who you're laying down with, you know, because that moment of when you have to give birth to this child is not going to be, you know, good if the person that you're laying down with is not worth 2 cents, you know. So I think that's something. So I'm glad that you're in the field. So thank you for the work that you're doing and the representation and stuff. So we're getting ready to wrap up, but like any just last words or any just like thing that you want to leave with?
I'll just say moms for sure. I write this in cards. I tell every mom, trust your body. Like if you don't feel something's right, trust it. If you don't feel something's right with the baby, trust it. Just trust yourself. Advocate for you and your baby, because once like they say, once a mom finds out that she's pregnant, she becomes a mom immediately. So it's like, trust your body. If you know something's wrong, you know, make sure you get the further treatment and care that you deserve, as well as that your baby deserves, because everyone deserves equal treatment and care. So that's the biggest thing. Trust your body.
Yes, I love that. So yeah, this is a lot of information. I'm so glad that this episode was done, but please go back if you did not if you weren't able to catch it. Do you want to give your Instagram or?
Yeah. My Instagram is at sweetasarose1.
Yes. So please follow her. Like I said, we went to school together. So
Yeah.
but I've been seeing that she's, been posting, and then just for her to be in the field and stuff, I think it's so necessary. And it's dope. So thank you for coming on.
Thank you for having me.
Yeah,
I love
definitely
this.
have you back, and
Yes.
I want to get like some moms and stuff so we get some actual experiences.
Right.
But,
Since we have not gone that process
right.
yet.
We just wanted
One
to
day.
bring some information to you. But that's it. We'll be back for episode 15 next week. But definitely make sure you check out some of the other shows on the network. Go back and watch this show or go back and watch some of the other shows. But this is New Black History Makers, and we are here at the Good News Network. I don't know why I forgot that. And but y'all stay Black and be blessed out there. Right.
Thank you.
Without the power of God behind everything I do, I really am completely inadequate.
I'm helping the culture. These guys are part of us as well. These are guys of our cousins.